All right, so we're ready to go live in just a second. I'm gonna just double check and I'll confirm. I'm gonna give you a quick countdown, and we're just gonna flow with it. And we are live. Hey, family, thank you for logging in today. Thank you for your patience. Um, Grateful to have very special guests tonight. This was not the platform we were using, but everybody was able to pivot very quickly. So we are getting adjusted. Let everyone know that we are finally live. And we're grateful to have our very special guest tonight for a very important conversation. Now, this is no gas, this is no hype. This is not to fraud anyone. This is a very, very serious conversation for our community, for our families. And this election is a very important election. All right. So we're going to give y'all 60 seconds. Go ahead. Let us know that you're rocking with us tonight. Let us know that you're on, and we're going to introduce our very special guests so that we can allow them ample time to share the information that they're going to be sharing with us tonight. So let's go ahead. Let's share this. Let's share this. I see a couple of shares. Thank you for logging in. Please let us know where you are logging in from. I see some hearts. See some engagement going up. Again, greatly appreciate you. Greatly appreciate you. Tonight we are talking about the future of healthcare coverage, and man, we have some policymakers on tonight. We have some CEOs tonight. We have some business professionals that will speak to this topic. What we would call subject matter experts, as well as those who are working in this area or and in some very high level conversations. So, Taisha, thank you for logging in. I see you. Yolanda Sargent, thank you. I see you. I see you. Yolanda, pull double duty with me tonight. We're going back on at 9 on IBW page. So hang out with me tonight. Appreciate you. All right. Ladies and gentlemen, again, thank you for your patience as we've been working through some technical things tonight. But I want to introduce our very special guest tonight. And I'm going to give them a moment to introduce themselves, their names, their companies, or their business, what they do on a daily basis, and talk about tonight's topic. But first, I want to go to our assemblywoman. Y'all, we have a very special guest. All three of our guests are very special, but I want to go to our assemblywoman, Shavonda Sumter. Shavonda, can you say hello to the people and introduce yourself?
Hello, hello, and thank you, Jason, for having me. Hello to my co-panelists. Hello, Mr. Brunson. Good to see you as well. I have the
Always.
privilege of being the godmother to his six beautiful girls. Uh,
hmm
so, you know,
And she used to beat me up when we was kids.
I did not. I never did that. We're in NAACP together. But truly, it's great to be here tonight to talk about this topic. Thank you, Jason, for taking this on because it impacts us severely. It's my life's work. I've been in the assembly since 2012. A big part of my platform has been access to healthcare for our community because of the disparate impact of us being able to access services at all levels, from maternity and from diabetes, from Alzheimer's, you name it. I've been in the fight making sure that we had access and knowledge. So thank you for this timely discussion and reminding us that our vote has power. So thank you.
Yes, ma'am. Thank you. Appreciate you. We're going to go over to Miss March. Welcome to the conversation tonight as we talk about the future of healthcare. Can you introduce your name and your company and your business and what you are doing?
Oh, hello. Good evening. My name is Kadria March. I am the owner and founder of Post and Claim. I am a certified professional coder and certified medical auditor. So I have been in the healthcare industry processing claims. Come December, it'll be 24 years. And I work in mental health. Underneath my business, I teach individuals to become a certified professional coder. I'm a consultant. I do billing as well.
Great, great. Looking forward to the conversation tonight. And lastly, but not least, very special guest, my good brother, Mr. Richard Brunson. Man, introduce yourself, brother. How you doing tonight?
Well, hey family, how we doing? Rich Brunson, Pattersonian, born and raised, life insurance agent at first, and I got into health about 5 years ago. Still learning, still a student. I'm still learning. I deal with seniors though, and I know what their issues are. I know what their complaints are. So I'd like to be able to contribute a little bit and just let folks know how to prepare for this season coming up.
Oh man, this is amazing. And so while I have you, panelists, if you would just allow me to address the Assemblywoman, for time's sake, and then we're going to kind of dive into some more dialogue, once we hear from her. But Assemblywoman, first question up is how will upcoming policy changes affect the access to Medicare and Medicaid for residents in areas like Patterson or across the state?
Great. Thank you for that question. So we've heard a lot about a federal government shutdown. And while some of us may think that doesn't have an impact on us, but it has an impact on services and access to services. Medicaid is 50% funded by the state of New Jersey, 50% funded by the federal government. New Jersey sends over 70 cents on every dollar to the federal government. To support our Medicaid program, we do more than our fair share to help those communities who, like rural parts of the country, that don't have the money, but we want a healthy population. With Obamacare, some of you may know, or the Affordable Care Act, because for those who say, I don't have Obamacare, I'm on the Affordable Care Act, or I'm on the exchange. That's how I got my insurance. That's close to 1 million people in the state of New Jersey. Purchasing healthcare is one of the most expensive things that impact families. So for us, having a portal, a pathway for affordable healthcare was a huge priority for years, and the cost of prescription medications. Let me not forget that point. So every election has consequences. So
Yeah.
while you may not have voted for the current president sitting in office, that current president has a budget that's looking to reduce access to healthcare in New Jersey by getting rid of the Affordable Care Act and elements of it. When you hear terms like, oh, we want to make sure able-bodied people are able to work, it's not an issue of able-bodied people being able to work. That's an old 90s Reagan policy. Old, right? Old language. I give Republicans credit on discipline for saying the same thing and still getting people to vote for them and never evolving. But for us in New Jersey, we expanded it so that you can have access to healthcare. St. Joseph's is our only healthcare system in Patterson. Only one. We used to have St. Joseph, Barner, Wayne General. St. Joseph's now owns Wayne General. Barner is now a dialysis center, a subacute care facility,
Yeah.
eye doctor, multi-service, but not a hospital.
Yeah.
And we're talking about a highly populated city of Patterson with 8 square miles. Let me make this make sense. It's 8 square miles with over 170,000 people on the books that live there. It's a safety net hospital. We have over 90 different ethnicities that are recorded living in the city of Patterson. So for us not to have healthcare and have a healthy health system to support physicals, rare diseases, general health needs,
Yeah.
emergency, trauma, all has an impact because we can't fund it. We don't have enough money, if you will, to fund it with the cost of healthcare. So we really need those anchor pieces, and that's what's at stake. So November 4th is an election. Ballots are out now if you have a vote by mail. If you aren't registered to vote, you have until October 14th, and you can do that online at NJ Vote to register to vote. You can do that online. And it's important. We can't afford to sit out and think that there's no consequence. Health is economics, if I can add that piece as well.
Yeah.
Because if you're not feeling well, you're not able to go to work, right? If your child's not feeling well, somebody has to take care of that child. So we are an advanced Western world that are still talking about access to healthcare for all, not some, not just for the wealthy who can afford it. It should be for all.
Yeah. Thank you so much for that insight. And I know you have to go in a minute. And you did mention how the funding or the impact of the funding would affect the services that we get. But can we go a little deeper into the part where you mentioned St. Joe's being like the only like facility? So
Yeah.
if the budget gets cut and Medicaid gets cut, can we give a little more detail and attention to that? What would that look like for our city?
Right. So it really looks like a critical crisis because who's going to make up the shortfall in that funding to pay the doctors, the nurses? Hey, we got a coder here in Miss March paying for the billing system to get them out the door. So um, it all has an impact. And also, St. Joseph's is the largest employer in the city next to the school district. So when I say it's economics, it's economics. And there used to be a thing called charity care where the state would make up the difference, would pay a hospital a subsidy for all of the uninsured patients that they took care of because there was a duty to take care of anyone who showed up at your doorstep.
Yeah.
That fund no longer exists because we expanded insurance options for people to purchase on the exchange, for people to have Medicaid. So any changes that's not expanding it is harmful to the very health and safety of the public in the Patterson area. Direct.
Thank you so much, Assemblywoman, and I know you have to go. So I'm just gonna, y'all, I had an opportunity to just share a quick dialogue with her. She shared this video. I'm gonna share it now because I know she's about to log off, but I'm gonna share this video as she goes because this
Thank
just
you.
gives just gives more insight to what she said. Assemblywoman, thank you so much.
But the new requirements and the bureaucratic hurdles that the law created will make it impossible for those individuals to stay covered.
The impacts of this we can't say enough about how destructive these cuts are to individuals, how devastating it is to the healthcare economy. And while the administration was aiming at the poor and hard pressed with this policy, everybody is going to be impacted. If your hospital closes, you're impacted. If the nursing home that supports your mother or other family members who need 24/7 care, you're impacted. If you have private insurance and go to a hospital that now sees less revenue from Medicaid and Medicare, there'll be cost shifting to you, so your insurance costs will go up. And the sad, cruel part about this is that all of these cuts are being made to give benefits, money, to put money in the pockets of the wealthiest people on earth, taking from the poor and giving to the rich. That's what's happening, and it's wrong.
Here in New Jersey, we serve 2 million individuals through our Medicaid program. We know it will be devastating for families all across New Jersey. There are about 350,000 individuals who are expected to lose their health care coverage, and we know that 70 to 80% of those shouldn't lose coverage, that they continue to be eligible, but the new requirements and the bureaucratic hurdles that the law created will make it impossible for those individuals to stay covered.
The impacts of this we can't say enough about how these cuts are to
Wow.
individuals, how
Wow.
devastating it is.
Wow. So Kadria, Richard, we will continue the conversation. But Kadria, let's talk a little bit about like just the coding and the billing. What give us an understanding or educate us on like your role in the whole like healthcare process.
So my role is as a certified professional coder is I'm in the back office of the clinic or a practice or agency or organization. So what our job is to read the documentation and make sure the codes that was selected by the healthcare professional supports the documentation. So if it doesn't support, then that's where we come in at, and we'll select the appropriate code for that service.
Cool. Over the years of you being in the industry, um, let's talk about, just some of the things that you've run into when it comes to patients and handling their payments, and their services, you know, and just receiving healthcare. Like, what have you seen? I, because I'm not sure if everyone is aware of like the potential impact of the big beautiful bill, you know, that's possibly coming in 2026.
So I left off that I'm also a patient advocate. So when I started doing medical coding and billing, and I came up with this idea to start this business, it started out as a patient advocate because people didn't understand their health insurance plan. And I found that to be very like crazy for something that you're paying for and you don't understand it. So I was in this position where I was a payment poster, and I used to have to take the phone calls because the patients would get a bill and then they'll call us, and I would have to explain to them how their health insurance plan works. So this is how I kind of started my business, and then just
Hmm.
have grown into other things as
Yeah.
teaching coding, doing billing, being a consultant. But it really started from me posting payments at a pediatric office where I had my first billing job at, and well, actually my second billing job at. And I just found that people didn't understand their health insurance plan. Like, what's a deductible? What's co-insurance? What's their out-of-network benefits? What their in-network benefits are. So that's where this post and claim kind of came about. So that was the biggest thing that I found to be alarming, was
Yeah.
people didn't understand their
Just
health
understanding.
insurance.
Yeah.
Yeah.
And Richard, we're coming to you, but I think this question you can definitely speak to, but we'll stay with you, Ms. Kadria. Just like the high out-of-pocket healthcare costs. Like, when people don't understand their policy, what they're paying for, they something happens, they go to the emergency room or go to the doctor and then find out this is not in the policy. Like, how how impacting, negative impacting is that to the patient, and then just, again, like, to our community, right? Because that's one of the focuses that we want to address tonight. Our community, the inner city, high out-of-pocket costs. How does it impact, their access to healthcare?
Yeah. So I say, to kind of decrease that risk of having to pay a high out-of-pocket cost, is to learn what your preventative services are. Because when you get the preventative services, it's basically based on your age. You're supposed to
Yeah.
get this specific service, like this specific screening. So it's kind of being able to catch that, whatever's going on with your body, before it kind of gets out of hand, or where you have to pay a high bill to receive that service.
Yeah.
So it's really hard, not like really hard, but I think it's just more educating yourself of knowing what your benefits are before. And that, I know when it's time to go to the emergency room, you just go. No one's really thinking about what's covered because
Exactly.
you're not feeling
Mm-hmm.
well. You just
Mm-mm.
go. So
Right.
that's why they also created the no surprise law, where it's that whole out of network, and the bill becomes balance bill to patients. The law right now is that you can't balance bill patients for procedures. You have to have a
Mm.
protocol in place before you be able to do that, meaning that the patient agreed that this service will not be covered. So that is something I did apply for. We'll see what happens if I get it. But that is another another kind of support system for patients and consumers, that they have that route to go into regarding these high medical bills if it's out of network, or you wasn't aware that you were going to be responsible for this.
Yeah, yeah. Kadria, we're coming back to you. Mr.
Okay.
Brunson. Mr. Brunson, man, jump in. And
I
we're
mean,
gonna
she
we're
made
gonna
some really good points, brother. I
yeah.
mean, we're at a point where there's so much information being thrown at people that the stuff that they're supposed to know gets overlooked. So like she said, like a summary of benefits is supposed to be explained to these clients as they get these new plans. And clearly that's not happening, or they're missing the information. The changes that are coming up every year, annually, they send an annual notice of changes to insurance companies. So if your policy is going to get dropped or there's going to be changes to your policy, they send that to you. Check your mail, people. Answer your phones. I'm out there with the folks. I'm getting the door slammed in my face. I'm the one getting fussed out of the house, out of people's houses when they, when information they feel, was uh mismatched or not congruent to what they were told the first time. So I hear what they and I see what they're missing and where people are kind of tripping over. And it's that loss of information. They're not getting the information about their plans and about what changes and what's coming. Positively, I can say like the out-of-pocket cost for next year is going to be for prescription drugs, Part D. That's going to be it's going to rise to 2,100.
Mm,
That's it. You know,
Wait, explain
that's
that.
a lot.
that's I mean, well, that's the cap. Like, okay, the
I
out-of-pocket
just
Part
heard
D prescription
2,100.
drug
Hold on, you're gonna.
rises to 2,100 with the automatic enrollment of the medical prescription payment plan. Last year, Kadri, I don't know, you might know where it was at, but I know that they're saying that that's the cap right there. So I'm figuring at least I can explain to you for your Part D drug, for your drug prescription, you won't be paying any more than 2,100 out of the year. And as like you said, everybody's face screwed up like, well, that's a lot too. But that's what I got to work with to go in with in terms of explaining that Part D and some of the new changes.
So in that Part D, you won't pay no more than 2,100,
That's the
right?
cap.
That's the
That's the
cap,
expected cap for
right?
2026.
No
Yeah.
matter what drug it is.
Right. Once you, and then the insurance company covers the rest.
So that sounds like to me like a deductible, but it's not. It's the
Right,
cap.
right.
Okay. So explain the
Oh, the
difference
word.
because some people won't go to the doctor because of the deductible, right? We're not even
I
like
know.
they won't go to the emergency room. They be like, no, I'm not paying that 200 or three.
Well,
I
that's
don't even know what it is
all
right
part
now.
of
Like,
what type of plans they have. Like we can't get
Yeah.
into plan specifics, but um these I don't know how to say it without, disparaging anybody. The agents need to really talk to the clients. And the clients sometimes, we rush through things and we don't listen. I'm a client as well sometimes. We don't listen to everything. We listen for the main things, the how much, the when is taking out coming out of my check, or how much I gotta pay, or what's my part. And a lot of
Mhm.
that's not really explained thoroughly enough. To remain compliant, there is a process. There's a process that people are supposed to follow, agents are supposed to follow, and that's not being done. And that's what I notice on my end. Like, so if I come across a client that doesn't have information, it's because he's not being told that information. Um, Clients get confused and disillusioned from whatever their old policy was, because you had a year at least of dealing with your policy before these new changes came up. So if you get offered during that time some new benefit plan or something else, or somebody says their friend got a better plan and you go switching over, that causes a disruption in terms of your coverage.
Perfect.
Do you know what I mean? And you're changing because of that benefit card, or somebody gets an extra $100 and they can go to this and get that, but you don't know what you're losing on the back end. That plan may no longer cover your favorite doctor or your best doctor
yeah,
or your medical
yeah,
plan.
yeah.
That's why you have to have a discussion with your guy. Your guy. I'm somebody's guy, but get to your guy. If you got a guy, get to your guy, your agent, and speak with them. Don't let people just switch over your plans. And this is to my seniors. I tell you, don't let them just switch over. Don't just jump on anything, because that causes a disconnect with the coverage of your plan. Kadriak, I'm sure you could attest to that.
Mhm.
Folks bouncing around just because they saw something on TV and then they switch and then like, well, how come my doctor's not covered anymore? That's why, because you're jumping around and you don't know what plan you join. Yes, okay, yes, you might have joined something that's zero premium, but your doctors are no longer covered.
You
So
know what? Thank you for tapping
it's a
into that.
longer.
Thank you for saying seniors, right? Let's stay there
Mm-hmm.
for a moment.
Mm-hmm.
Kadria, as a patient advocate, I'm not sure if you dealt predominantly with seniors or there was, I mean, probably generally there was no specific age range per se, but I want to talk about the seniors, right? Because it it appears that we all may be the same age, right? So, and if you have living parents, then you're probably
Mhm.
actively
Mhm.
the new parent, right? Roles are switching,
Tell
right?
it.
So
Tell it.
Reverse.
you making sure you know the names of their
Mhm.
medications. You're making sure they're keeping up with their doctor's appointments. You're having arguments about their diet, right? If you don't go to the doctor with them, you're like either calling the doctor behind their back because you don't trust the information that they come back with. That's reality for a lot of us right now, and I kind of want to stay there for a minute and hone in on this because it's a serious thing, right? Like we're planning. So on top of our home duties, right, of
Mhm.
our spouses, our mortgages, our insurances, now we're adding our parents who become an extra body that we have to uh, be concerned about, right? And that's not to dismiss any senior, but you have your children helping you. That's just
Yeah.
where it is. And I want to talk about that. What are just a couple of important things that we should be looking out for right now with the pending changes of cost rising. What are some concerns you're running into with patients? What are some conversations you're having with those caregivers, or even in just situations that you've kind of stumbled up on in a sense of your
So,
research and your experience? Kadria, you can start.
oh, well, my parents will be, well, they'll be eligible for Medicare very soon, probably in a year or two. And Medicare is a whole different beast. It's different from commercial plans, as in rules and guidelines that you need to follow. They are the number one payer from a billing perspective, but there are specific things that are covered. There is a lot of information, and as they get older, the site is not that good. It gets to
Yes,
be
it's
overwhelming. You
information.
got yes, it's a big book of probably 100 pages. The font is small. So what I recommend to my parents is definitely to look into long-term care for Medicare, because if you get hospitalized, you're only going to be allowed to be in the hospital for a certain amount of time, and then they're going to discharge you, and then you have to start the process. It's called an episode all over again. So if you have that additional coverage called long-term care, which I know I'm going to get when I get to the age of 55, just to be prepared for it, because they don't cover that. Medicare doesn't cover that. And Medicaid, yes, they'll cover like the home health aid for them to come to your house, but it's like a whole process with that. And then the direction we're going into, we don't even know what it's going to look like with the Medicaid. So I recommend individuals to purchase a long-term care premium or account
Mhm.
insurance
Long-term
policy.
care. Yeah,
Yeah.
Mhm.
that's good.
Long-term care
Um,
plans, hospital indemnity plans.
Brunson,
I-
speak to that a little bit because I think man, it's a conversation, right? Because you get into short-term disability, long-term disability, and like there's different criterias for both. Long-term care, and let's stay there on long-term care, especially because, like, my dad lived till he was like 88, and when I say he was outliving policies, so
Mhm.
it was
He was out living policy.
God, Dad, I am not rushing you to leave here, but we gotta find something to make sure he good because he's past the expectation, right? Biblically and society's
Mhm.
metrics, right? So it's like, oh man, like we gotta make sure that he's covered because it was more doctor visits, it was
Mhm.
more hospital, it was more hospital experiences, right? And I think his last stint in the hospital, it was like maybe 4 months, right? And then they went
Mm.
home and then they kind of like reset. And
Yep.
then
Episode.
so let's dive into that because again, there are a lot of people right now that are overwhelmed, that's trying to figure it out, and we need some they need some guidance, right?
Uh,
How can we talk about that long-term piece, man? Like how
well, I try to encourage people, don't be scared, because like you said, there's a lot of information out there. Off the cuff, without having to read, long-term care basically covers those situations where you're expected to be, you're going to be sick longer than you planned on being sick. that coverage, having that coverage in terms of having like a regular monthly premium that covers those expenses is like a safety net, because in terms of your regular insurance, your costs, your out of pocket costs can rise to a number that just insurmountable, and that can break the home, it can break the house. So the long-term care concept to me basically covers you in case you get one of those debilitating injuries that or diseases or illnesses that's going to go be ongoing, and that can just like cripple the whole house. If the insurance company can come in and kick in and help cover that bill, then that saves the day. Uh, it's the same deal with the cancer plan. If you know you have a
Mhm.
history of cancer in the family, and your lifestyle is similar to those of that person, I mean, But I'm not here to sell though, brother Moody. I'm here to talk about enlightening people and getting information and finding.
Well, here's
Um,
here's the thing though, right? So, all right, you're not here to sell, but you have information that we need.
well,
And
yeah, that's why I want to share it. That's why I want to share it.
if that leads to a sale, then that is what
Then
it
to be
is,
continued,
right?
right? Yeah,
To be
yeah,
continued. Because I
yeah.
am gonna ask you guys for, your contact information before we get off tonight for those who do have questions. Because it's man, I found out that resources are important. Having the right resources are important. Resources are a commodity right
Yes,
now. It's a
and that's all we
very
can. That's all we can
valuable.
rely on right now is each
th-
other and our connection and our communication.
Yeah, the relationships is vital. Because again, I've gone through the whole, taking care of parents. My brothers and I, we had both parents in the hospital at the same time.
Oh, wow.
For I'm gonna say life changing experiences. My dad will go in with two legs and come out with one and a half.
Mm.
My mom was on dialysis and kind of, going through that process and, having some heart issues, right? So it's kind of like, all right, put mom down there, put dad up here. Let's split responsibilities. I'll make sure dad is good. You make sure mom is good. What what's the health insurance? What's the prescriptions? What was the last doctor appointments? So like these are very real, scenarios, because it's happening. And the other thing that's happening, man, some of these sicknesses that were once uncommon are now common now. Like we're
Very
seeing diabetes impact people's lives at higher rates. We're seeing high blood pressure impact people's lives.
and
Younger
at
people are
younger
getting
rates too. Yeah.
young.
Yeah.
Yo, that's where I was going. Younger people are getting heart attacks, strokes.
Oh, yeah. My daughter
Uh,
just told me one of her, she's 20, had a heart attack in college.
so y'all, when we grew
That
up,
breaks my
right?
heart.
So I'm figuring, we're 70s. I'm with no 70s, early 80s, right? Um,
70s baby here.
I don't remember any of at that time my parents' friends who were in their late 20s, 30s, and 40s experiencing sickness at this rate, right?
Mm-mm.
And I even saw something today where it said, it's interesting because our grandparents, they ate pork, um, they smoked, they drank, they did all of that, right? And they lived.
The 80, 85.
Yeah, but now something has happened, right?
I can get into a whole bunch of stuff, brother. It'll be a whole longer. But mainly, we have to take care of ourselves. We got to eat better. Um, like you said, now that we're monitoring our parents, don't forget that they raised us, so they still have that sense of wanting to be independent. So we can't tell them but so much. So we got to observe how they're moving and pay attention to what's being told to them, because the doctors have their loyal, like they have their loyalty to their doctors. They'll listen to what the doctors say. But if you come behind and try to say something, you don't know what you're talking about because you the kid. So you kind of got to listen to what the doctors say and challenge it and let them see where that information is a little bit shaky or questionable, or just need some reinforcement. Like some things just need to be like, well, you heard what the doctor said. We got to do this, or we should do this, or we should cut that out of our diet. Because like you said, if we eat better and take better care of ourselves, that can cut down on a lot of our issues. But back to insurance. I highly recommend talking to someone about whatever the situation is in terms of what your expectations are health wise. Make sure you're in terms of Medicaid and your insurance, if you're approaching 65 or if you're already on Medicaid, Medicare, get those gaps covered. Make sure your gaps are covered, those financial gaps that are not covered financially. Um, if I can just throw out plans, Medicare Advantage plan, G and N are the better plans, but you got to see if they're all covered in your area, which is all conversations. And what I hate to tell people, it's not a short conversation. It's got something you got to sit down and talk about. Can't just rush through it. Okay, I'll take this. You got to talk about what's going on with people health wise. Certain companies cover certain things more than they cover other things. You know what I'm saying? Like certain companies are more willing to kick out more for diabetes as opposed to something else. So it's a conversation, and my challenge with folks is they want to rush through the process, and you gotta nowadays we gotta watch what we're jumping into because you don't know how it's gonna affect you later on in the year.
Oh man, that's
Yeah,
good.
I could piggyback off of that as well
Yeah.
as, especially with Medicare, outpatient services is covered at 80% and 20% is patient responsibility. So you always have to make sure you have like a secondary insurance, and that's when people have dual plans, which they have Medicare. Medicare will be primary and Medicaid is secondary because that's considered to be last resort. So if you don't have a secondary insurance, that means you're gonna incur that bill for that 20%. So
Hmm.
that has been the rule for Medicare for years. That for outpatient services, you're responsible for 20%. So it's just to be mindful of that when you go to your outpatient services to receive services, that if you don't have a secondary coverage, you're going to be responsible for that 20% balance.
Mhm.
That's good. That's good. Thank you. Thank you. Thank you. Thank you for sharing that. I don't know. Um, I don't know how many understand the importance of having not just insurance, but the right insurance. Because some will do something to just get enough.
Mhm.
And in 2025, I don't know if just getting enough is actually enough.
And I'm an agent and I'm guilty of it. I will get just what I need sometimes out of certain things, like for my phone or for the car, knowing another problem can possibly pop up. But right now, this is what I got to work with. This is what I can handle. So,
Mhm.
we're inundated with a whole bunch of drama, news, positive things, negative things, and this and that. And then on top of that, our health situation and finances. It gets confusing and we get overwhelmed and we start to put the important things to the back burner, and then it hits us, and then boom, before you know it, we got to shell out our pocket $5,000, or we're on the hook for some medical company for $5,000, and now they got a lien on our house or on our credit, and causes more problems and more drama and more. So yes, we need a serious conversation about how important insurance is and how necessary.
Kadria, like how was that transition with advocating, being an
Mhm.
advocate for patients and then going into like this billing? Like, are those roles connected or they're two different roles? Like, are you still advocating for the patient or I mean, like how does that work? How does that work? Just
So I'm both. So I'm ensuring that the doctor gets paid, and I also, because if they don't get paid, I don't get paid. That's not gonna work. So I'm both.
Okay.
As in, I will advocate for someone as well, because what happens is, being the fact that it's so much information when it comes down to this coded and billing, and a lot of people are not trained properly. So what ends up happening is we incur these bills because the wrong code was selected. So
Yep.
and I'm gonna be honest, if I wasn't in this, I wouldn't even probably pay it no attention. But due to the fact that I am in it, I don't pay a lot of my medical bills just because I know the codes and I know that they will select the incorrect code, and I have to ask them for my medical notes to see what did they document on that day. And if it wasn't documented, I don't pay it. And they just adjust it off because or they rebuild it with the correct code. So it's kind of, as a consumer, that doesn't know this information, I highly recommend individuals to sign up with their health insurance portal where you'll have access to your information, like your claims
Mm-hmm.
that got submitted to the insurance
Mm-hmm.
company. Because every time a claim is submitted from your doctor's office, you're going to get an explanation of benefits in the mail, or EOB. And
Mm-hmm.
that also give you an opportunity to be like, oh, let me see if this is the correct date of service, because a lot of fraud goes on too with billing for services. So it's like just being abreast of this, because a lot of changes also happen. But I do recommend that you set up a portal account with the health insurance carrier that you have and review those dates of service. They also, a lot of these platforms or these health insurance platforms, they'll have a section where your CPT codes are. So you can confirm, like, okay, I went for a physical. That EOB should say physical on it. Or they'll probably have an evaluation and management code up there. So it's, yes, that's the hard part about it, like really finding a resource that is going to be able to break it down for you. So I am a resource for individuals who need a breakdown of their explanation of benefits, or when they get these bills from their doctor's offices and they don't agree with it. Because again, a lot of fraud does go on.
Yeah, yeah,
I can only imagine the fraud.
that's
Wow. Yeah.
um in both of your professions, what's the biggest misunderstanding that you've seen? I don't want to talk about any other community. Let's talk about our community for right now. Like, let's focus. What are some of the biggest misunderstandings that you've encountered that you are
Regarding health
you,
insurance or life insurance or insurance in general? Because
let's
I can bark about a couple of them.
let's
I
stick with
have
healthcare.
one. I have
Let's
one.
stick with healthcare. Let's stick with healthcare for now. Let's stick
Okay,
with
okay, let's
healthcare.
stick with
And
healthcare.
Rich,
Let's
we
to
can
be
come back
continued
and do
that
the whole life insurance thing,
right.
because that's a whole nother conversation.
Man.
Because again, because we are marginalized and because we are under resourced, a lot of things get thrown at us and we become victims.
Mm-hmm.
And I am not, and I am not for victimization. I am not a victimization
Yeah.
advocate. I don't
I don't
believe
like
in you
claiming it.
just
Mhm.
being a victim, but I do understand that we become the target because of lack of resources. And as mentioned, a lot of things get thrown at us, and if we are not educated, we will make decisions that keep us in certain financial
Mm-hmm.
states,
Yep.
and we get trapped. What so to both of you, from your experience with healthcare, with billing, and in that context, um what's been the biggest misunderstanding that you've encountered with our community?
More re
Deductible.
Go ahead, my
Oh,
lady.
go ahead.
No, 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 my lady, you go first.
Deductible. I think it's I don't even know. Like, I think they don't understand what a deductible is. So what I compare it to is car insurance. What happens with the car insurance? What they say, I'm not gonna pay out until you meet your deductible. Same rule applies to your health insurance. If your deductible is $1,500 for the year, then depending on what services it gets applied to. After that, once that $1,500 is met for the year, then the insurance company is going to pay at 100%. So that's what I think in our community is a mixed understanding what a deductible is.
Yeah.
Mm-hmm.
Yeah.
Mine would be the confusion about that prior authorization. It comes up a lot in terms of what insurance companies will now not cover because they want it to be approved by your doctor. They want to approve it. They want to make sure you need it. And a lot of things, especially with these more popular Manjaros and the Ozempics, these
Mm.
drugs have multi-uses. They are for sugar, maintaining sugar levels, and they also allow or promote weight loss. So doctors are finding they got that leeway now. They have that gray area of saying, no, that's not what you're using it for. You're trying to use it for weight loss. But if it's actually helping somebody's sugar, which is the original reason it was made, they need prior authorization and all these other hoops that this young lady has to go through. And we're just trying to work that out, and I'm trying to figure out how to help her with that. But
Diagnosis code. They got to select the right diagnosis code for that prior
Thank you,
authorization.
girl. Thank you.
This
But
is coming together.
but
Um,
those are the type of things we need to explain to folks, and I don't mind sitting down and explaining it. It's just that they take time, and you have a family, everybody has family, we have things we got going. So what I recommend for seniors that do need help and have questions, get a list of your doctors, have it ready. Get a list of your prescriptions, have that ready. You know, if you have a ballpark idea of what a generic one is, keep that in mind. But at least have those two things ready when you're talking to people about your healthcare. Your list of doctors and your medicines, because that takes up so much time just trying to figure out what's still covered and what's not covered. So
yeah,
you're ahead of the game right there. If you can just keep that handy when you're talking to somebody.
yeah. Real quick, Richard, I think this question is going to be more so for you, as it pertains to strategy,
Mm,
for seniors. So, of course, Medicaid, would look at what a person has, don't have, assets, things of that
mhm,
nature. As they age, some are asked to present their assets, um, and they will assume or they would have to give up assets in order to receive certain services. Uh,
mhm.
can we, in terms of long-term health, can we speak to that, man? Like, what, how should we be navigating? Su- Suggestion, right? And
I'm
disclaimer,
yeah, go ahead, do
disclaimer.
that one first.
They are acting out of their own cognizance. They are professionals, but you should also seek
Seek, right. Seek more information.
more information and legal consultation
This is not legal
from.
advice.
You cannot say you were listening to Live with Jay Moody and
And they
Kadria
told you to
told
do this.
you
Right.
what she said, like you were personally in the conversation with her, that you need to make sure you get my code right. If you don't get my
Mm,
code right, I
mm,
am not paying. Right? You are
mm.
taking the Trump I pay zero taxes. Like, all right. But yeah, man, that's a real thing, man. And I think, like, I don't know, is there a way? Like, how do we?
Planning ahead. I mean, like you said, that's all financial education. Planning ahead, like through experience, I've learned some folks signed over their assets to their responsible child earlier in life, maybe 5 or 6 years before becoming really, really ill.
Mhm.
Because I found out that if you have to go into a nursing home and you try to sign over your assets, that month, they're not allowing it. They're still coming for those assets as if, that's money that you can be paying toward that bill. So you got to kind of plan ahead, like other folks do. They plan ahead. That's already documented and in place so that they can take advantage of the other half of what the government's giving out. So we're definitely behind the ball on that, and you know exactly what I mean. We are behind the ball on that because they will come for your assets once. You know how that bill keeps ticking down and trickling down until the money is all gone, and then you look like they worked all their life and it's gone, in their senior years. That's to me that upsets my stomach. I think that's a whole legal thing where that just shouldn't even be allowed, but it is what it is.
Yeah, talk about being in the race or the rat race where when you're younger, it's the go to college, get a good job,
Mm-hmm.
buy a house, the American
Mm-hmm.
dream, only for you to get sicker later in life and then have to give all of that up, right? And still don't receive the proper care.
Right. In your senior years. Can you imagine? That's heartbreaking. And then to look down the line and see that whatever property you owned, the family lost it due to taxes or whatever, and this and that, or through your old bills. Sometimes your old debt can cripple your family, while you're gone. That's the whole life insurance bit. But it's a whole educational process. What we do with my team, we hit senior buildings. We hang out with seniors. We talk to seniors. We educate seniors, and it's just like a relationship. It's not a one hitter quitter. it's a relationship. We got to sit and talk to folks. We find out, what their issues are, what their health issues are, what their major concerns are, and we put them with the best companies. So we're brokers. We don't just push them to one particular company. We try to find what works for that individual. So it's
Yeah,
tricky, it's
guys.
challenging, but
Yeah. Um, so y'all, so I'm gonna tell y'all this might be a part two because there's some things that are
it's gonna
coming
have
out
to
of
be,
this
man. It should be. I mean,
conversation. Yeah, we may have to do a couple of weeks of this. But this will be before the year is out because now even just speaking to having someone to speak to the financial strategy part of insurance, right? Whether it's life insurance, whether it's healthcare coverage, long term, short term, because again, because this is election season, everybody talk about affordable, and I had the opportunity to ask questions to a potential candidate, and my question to them was, what is affordable? What are you calling affordable?
right, right. What's affordable on your list and what
Because it's
compared to me?
subjective, right? You're saying, oh, we want to get affordable housing, but like, yo, 1,800 for a one bedroom is affordable to who?
Not to
Because
me.
while like at my job, they just did a cost of living analysis, and basically wherever they did a comparison between states, and if you were in a certain state where you were below, they basically kind of closed that gap a little. I don't know by how much, but they
Mm.
closed the gap. Like if you received the extra however much to
By
go
closing the
to.
gap, they kick in the rest, you mean?
Yeah, so our job in terms of the salaries, like you got, so it was time for raises. So you got the regular raise, but then you got the cost of living wage raised as
Oh,
well.
nice.
If you were below, man,
Mm.
shout out to Staples. All right, like but
Oh, nice.
they
Yeah.
listen, but they basically, you got a little extra, right? So, but that was before this inflation, right? Like literally like probably a year or two before everything really started kicking in. But I think there has to be a conversation with all of that in to talk about really, what's affordable because I don't think everybody's really living above their means. For some people, like I've learned through community service, right? When you're doing like food pantries and things, man, some people have just enough money to pay their rent, car note, car insurance. That's it.
That's it.
They are value milling it up. They are, you know what I mean? Or, and so when they come to food banks, when they come to, uh, where people are serving, hot meals, you're gonna find some working professionals.
Hmm.
Oh, no, they there.
Yeah.
So, and that was
Yes.
eye opening for me. That was
Oh,
very eye opening for me because you hear less fortunate, you kind of got a certain visual in your head, and you don't realize the person you've been standing to the whole time, laughing and joking, kiki and hi hi, was a part of that group, right?
Hmm.
And it's like
yep.
sometimes as much as it may look like, all right, it's above minimum wage, it's still not affordable
No.
to, like, it's still not enough. So I think that's a serious conversation, and I think that definitely has to be looked into.
Yeah.
Um, but man, I would love to have you guys back. Um,
I'd
to
love to
talk a
come
little
back,
more, and
brother.
I'll
I'd love to
add,
come back.
yeah, we'll add a couple of more in the healthcare sector, and even have some in the financial sector to really talk about that. I think with what's pending, I don't know if people know, you know how much the impact is going to be when they're talking about the dollar crashing, and the changing of currencies. Man, it's just so much, right? As we already said it. We already said it. I know we already
I'd
said
like to get past this government shutdown first. If they can
it.
can
Man,
come up with a
so
plan of what they're going to agree to so that these Medicare plans can actually have actual full numbers, because I hear this bill has a lot of decisions pertaining to the Medicare plan. So we need to find out what they're going to officially come to, because we can't really sit
yeah,
down and give a client official numbers until, you know, they finish doing what they're doing.
yeah. Man, listen. I'm gonna give our panelists a few moments just to kind of talk about some things that are on their heart, just to close out. But to our listening audience, those that are watching live now, those that will watch the replay, you got 30 days to watch the replay. Facebook is gonna delete it. I am going to download this episode and put it on our Facebook page. The other platform we were on would allow me to stream to both pages at the same time, but I'm gonna have to upload this one, so you can go to YouTube and watch this for a replay for those who would like to, just kind of recap and come back, and then we'll let you know when we schedule another conversation, and we're gonna add a few more guests to go a little deeper and just make sure we're educating our community. Listen, I am all about solutions. I don't have all of the answers. I know how important it is to know the right people to get things done. Everything is going to come with a cost. And I know our community, we love free stuff. We love to get put on. But y'all, we got to take a step back. I know, you want to turn up, but we may have to sacrifice a few years just to ensure that us and our families have what we need. Um, it is not fair. It is not fair that we die and our families have to struggle and strategize to properly bury us.
Mm.
Say it every day.
And we turning up, but we are not
Mm.
thinking about our families. That is not fair to the living, that they have to grieve and plan a funeral. Let's do better. Kadria, what's on your heart, sis? Also share where people can follow you, how they can reach out, or just all those things. Let them know.
What's on my heart? I think it's just more of being abreast to changes and learn your plan, especially that it is open enrollment period right now for many of us, and I have to review my plan. I review
For the
my
seventh.
friends' plans as well
Mhm,
because they
mhm.
they like help me with this, but definitely that's what I would share. And will share also that I do have an upcoming medical coding cohort for those who are seeking a career change or want to work in the back office, and that starts January 6th, 2026. And then I also host doula, medical billing doula support for those who
Doula
become
support.
certified doulas and they want to
Yeah.
learn the reimbursement part. So I host that
Mm.
once a month, the first Saturday of each month, because we need this support in the communities. And I think what hinders a lot of doulas is the reimbursement part. And like you said, things come with a cost. So I'm here to support doulas with that aspect. And you can find me on Facebook, Post and Claim, and on Instagram, Post and Claim. And my website is postandclaim.com.
Yeah. Rich.
Well, I'm just out here in these streets trying to let folks know. Like she said, it's open enrollment period starting October 7th. So now, October 1st, I'm officially allowed to start talking about policies to people. But in regards to staying compliant, prior to that, we couldn't really say nothing. I don't know if you can see my shirt. I just walk around with this shirt on, asking me about
Oh.
Medicare. Um, it's
Phew.
cute and it's funny because I can't just go talk to you about Medicare. You got to ask me first. And once you spark the conversation, then compliant wise, I can start telling you, okay, well, then we can do this and do that. I need you to contact me and blah, 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 blah. But it's so much, like you said, so much fraud going on out there. They're on us in terms of how we even approach seniors. So that's why you see the shirt. That's why you'll probably see me outside and you'll hear my daughter say, "Hey, Daddy, don't you sell Medicare?" And then
Ah.
I just have them talking up stuff. We do fun stuff, but just to get folks talking and feeling comfortable and remaining compliant. So you can find me at planenroll.com, Rich Brunson. You look it up. I'm gonna give Brother Moody my link to the chat so you can find me there, or
Yep.
rjbrunson.com. I mean rjbrunson22@gmail.com. You can email me. But there's a link to the proper way to reach out to me so that we remain compliant and I can get you the information you need to get, and I don't, cross any barriers and get myself in any trouble. But
Yeah.
this was fun, and
Yes.
I look forward to doing this again. I want to get on the streets though. I want to get face to face with people. I want to get back to Patterson. I mean, we've done it in Cleveland, the ice cream socials and the senior dinners, and we do raffles. We just do fun stuff to to get seniors out and open and talking about their situations. So senior feedings and stuff like that. So
Yeah.
especially around the, the 15th and the 20th of the month when,
Yeah, that's
money's
a
a little
very
tight.
that group is definitely high on the target list for
So let's do this
scams
again, family.
and
Thank you for
fakes.
having
Yes,
me.
let's do this
Man, I,
again. This
I
was
really
fun.
Please,
appreciate you
please,
guys
please.
for this open. I'm gonna just call this the beginning of the dialogue because there's so much that was shared tonight. And I think it was enough to get us going, doing some research and having conversations. And everyone, please go back, rewind this part when they gave their contact information, and slow it down, pause it, write it down, play it again, make sure you got it right, and reach out to them. But I greatly appreciate both of them. Everybody, we want you to have a blessed and wonderful night. Man, just a bunch of things happening this month. Go to my page, Facebook, jae.moody12, IG, jae.moody12. Share a couple of announcements. There's some things that are happening this month, and man, want to stay connected. So appreciate you all. God bless, and have a great night.
You too. Thank you.
Thank
God
you.
bless.